Can you open for me?
Patients prefer to care for their own needs. However, this is not always possible. By giving skillful, considerate care, you can promote a person's cleanliness, comfort, and health while reinforcing their well-being and self-worth. Of course, encouraging patients to do as much for themselves as possible is important. But when patients need help, you must show compassion and competence. As you watch this presentation, you will learn how to integrate personal hygiene and grooming into your patient's total care. The observations you make and nursing interventions given while providing hygiene to patients can provide important information about all of the patient's healthcare needs.
Hello, Mr. Eldon. My name is Dewan. I'm your nurse for
today.
To
help you learn skills for personal hygiene and grooming, you will meet two patients. Mr. Eldon is being treated for a respiratory infection. He experienced a stroke 2 years ago and is weak on his right side. His left leg is amputated above the knee. You will gather information for a database to guide his ongoing care. Mrs. Callahan developed a serious infection after surgery. She has pain, especially when turning in bed and while performing coughing and deep breathing exercises. Mrs. Callahan is receiving medication intravenously. You will help plan her post-operative care, including assistance as needed with personal hygiene and grooming. Using Mr. Eldon and Mrs. Callahan as examples, the skills addressed in this presentation are oral hygiene, hair care, shaving, nail and foot care, and dressing.
Laura, today we'll be doing oral care.
Remember, when you perform these skills, you need to follow infection control guidelines, encourage personal choice and participation in care decisions, protect your patient's right to privacy and the confidentiality of information, promote comfort and safety, use proper body mechanics to protect the safety of you and your patient. Finally, select proper equipment based on your patient's needs and agency policy.
You're here for a respiratory infection, correct?
Correct.
Okay, we're just going to check your lungs and see how they sound, okay?
All right.
I'm going to help you to sit forward. You're putting the bed up. Okay, and you can lean on
Okay.
Your patient's abilities and limitations can change over time. It is important to conduct an ongoing assessment during all client encounters to determine the best way to assist a client. For example, Mr. Eldon is able to perform some of his personal care without assistance, but he needs help setting up and handling supplies and must be observed to ensure his safety. As his health status changes, the level of assistance he may need with supplies may also change. Mrs. Callahan's participation in self-care should improve significantly as her mobility increases. In the early post-operative period, you may perform some activities for her or delegate them to assistive personnel. However, as she becomes able, you will plan for her increased participation. The following questions will help guide you in the ongoing assessment and planning of Mrs. Callahan's care. What level of assistance does your patient require? What health or treatment factors should be considered in the schedule or techniques for personal hygiene and grooming that you will plan? What are your patient's preferences for the type and schedule of care? What assessment findings should be monitored for this patient?